My name's Tom Buchholz. I'm a radiation oncologist at Scripps MD Anderson, where I'm also the medical director of the Scripps MD Anderson Cancer Program. One of the most exciting advances in early stage breast cancer with respect to radiation treatments is the use of what we call hypofractionated radiation. So radiation is given in a series of fractions or a series of daily treatments. Historically, those were given in 2 gray or 200 rads of radiation per day and extended over a 5-week period. So 200 times 25 treatments, 5 days a week, would equal 5,000 centigray or 5,000 rads of treatment to the whole breast. What hypofractionation means is that we're using a higher dose per fraction, but fewer fractions, and so a lower overall total dose. So the first trials to explore hypofractionation tried to decrease this 5 weeks of treatment to the entire breast down to a 3-week treatment course. And importantly, 2 trials, one in the United Kingdom and one in Canada, conclusively demonstrated that that can be done quite safely in breast conservation. So they found equal, highly effective rates of tumor control. And actually in the United Kingdom, they demonstrated that the fewer treatments caused less side effects. At MD Anderson, I participated in a randomized prospective trial, also looking at a 3-week treatment. And we noted that the patient reported outcomes were likewise better. They felt better during their treatments and they had lower risks of toxicity. So the 3-week treatments instead of 5-week treatments are also much less expensive for the healthcare system. So it's really an improvement in what we call the value of radiation because you're getting better outcomes and you're getting them at a lower cost. So everybody seems to win in this occasion. The patient feels better, they have less time off away from work, they have less travel, the treatments are over and done much quicker. So it's a win-win for everybody. Now, what's even more exciting is we haven't stopped at 3 weeks. Just recently, last year, the results of a randomized prospective trial comparing 3 weeks to 1 week actually found an additional positive result. This hasn't been yet widely adopted for all our breast conservation patients, but the early results from this trial called the Fast Forward trial were pretty impressive. It was a very well conducted randomized prospective study. And the evidence was clear that one of the arms where they only treated with 5 fractions was equal to the arms of 3 weeks. So it's possible, and I predict moving forward, that a large component of the breast conservation patients may be able to be treated just with a week of radiation treatments, which would further increase the value of radiation again, making it much more convenient for patients, making the side effects of treatments much less. So hypofractionation has really made an important role. To date, it's been used, it's now considered the standard of care for patients treated with breast conservation in the setting after mastectomy or post-mastectomy radiation, or when regional lymph node radiation is required, so patients with more extensive disease. Hypofractionation is still being investigated. The results aren't as mature as it is in breast conservation, but we hope many of these same concepts will be proving true for all classes of radiation or breast cancer patients moving forward.